Okay.
Okay, welcome everybody to our third installment of Brain Health Across the Lifespan, our fall lecture series. I'm Sarah Nico, and I'm really excited about our guest speaker today. I would like to start this presentation with a land acknowledgement, and so I also want to, I try to do the best I can with pronunciation, so please forgive me and give me a little grace if I mispronounce some words. So here's our UAS land acknowledgement. Our campuses reside on the unceded territories of the Akwán, Tontaquan, and Cheechakwan on Linga and Nye, also known as Juneau, Ketchikan, Sitka, Alaska. We acknowledge that the Tlingit peoples have been stewards of this land on which we work and reside since time immemorial, and we are grateful for that stewardship and incredible care. We also acknowledge that our campuses are adjacent to the ancestral homelands of the Haida and Tsimshian, and we commit to serving their peoples with equity and care. We acknowledge the series of unjust actions that attempted to remove them from their land, which includes forced relocations and the burning of villages. We honor the relationships that exist between the Lingat, the Haida, and the Tsimshian people and their sovereign relationships to their land, their languages, their ancestors, and future generations. We aspire to work towards healing, liberation, recognizing our paths are intertwined in the complex histories of colonization in Alaska. We acknowledge that we arrived here by listening to the peoples, the elders, the lessons from the past, and these stories carry us as we weave a healthier world for future generations. I'd also like to thank our sponsors, UAS Arts and Sciences and Dean Sulcatus for their approval of this fall lecture series, as well as AARP, the nation's largest nonprofit and nonpartisan organization who is dedicated to empowering people over 50 and older and to help them live and age well, and also SAIL, Southeast Alaska Independent Living, which empowers seniors and people with disabilities by providing services and information to support them in making choices. And also, I'd like to acknowledge Dr. Linda Kruger, who's here with us on Zoom, who has been a great partner as we developed this series together. So thank you, Linda, for all your hard work and input. And last but not least, our wonderful guest speaker, who I am so excited to have here today, Dr. Maria Crouch. She is a clinical community psychologist and a postdoctoral research fellow at Yale School of Medicine in the Department of Psychiatry. Her clinical work and program of research is focused on the intersection of trauma-informed care, evidence-based practices, and practice-based evidence to address alcohol, drug misuse, trauma, and the social determinants of health among American Indian and Alaska Native communities from a cultural strength-based approach. So welcome, Dr. Crouch, and is yours.
Wonderful. Well, Dogaden, I thank you. I really appreciate being here today. So today I'm going to talk with you about a study that myself and Dr. Rosalind Rossick conducted in Alaska among Alaska Native elders to better understand aging in a good way and Alzheimer's disease and related dementia, or ADRD. But first, I'd like to introduce myself. And in Alaska Native culture, we often say, "Where are you from?" which really means, how can I know you? How are we connected? So a day, hello. My name is Maria, but my Degnach name is Tavo. My mother is the late Joanne Mignano of Wasilla, and her and our family are from the native village of Anvik, Alaska, and of the Deg Hit'an tribe. My father is Robert Galvin of Manila, Philippines, and he and our family are from San Antonio, Texas, by way of Monterrey, Mexico, and we are of the Coahuiltecan tribe. And my partner is Dean Crouch, and he's of Cherokee heritage, and our son is Bodhi Amari Crouch, whose Deganok name is Yakatsi. I'd also like to acknowledge the land on which I live and work, which is in Connecticut, and it was originally inhabited by the Mohegan, the Mashantucket Pequot, the Eastern Pequot, the Shattuck, the Golden Hill Pagusset, the Niantic, and then the Quinnipiac and other Algonquin-speaking peoples and nations. So Dogajan to them, but also to you for being here with me today. Okay, so here's a brief overview of what I'd like to share with you. I want to give you an introduction to the context and background of the research. explain the study and the observed overarching themes, share about the theory that was derived from the data, and then discuss the implications and takeaways of the research. So hopefully I want to talk a little bit about Alaska. You know, I'm from Alaska. The research was conducted in Alaska. And hopefully this is very familiar to you. So Alaska is derived from an Unaga word, Alyeska, which means great land or mainland. And Alaska Native peoples represent 8 distinct and beautiful tribal groups, which you see before you in the slide. This is composed, so we compose 229 of the 574 federally recognized tribes. And really that says the diversity and complexity of Alaska Native culture is so large and vast. However, in the face of tribal autonomy and challenges, Alaska Native peoples share common beliefs, goals, and then going back to challenges, because these are really made manifest by geography, by cultural expectations, access to resources, and then the predominance of Western systems of care and caregiving. While colonization of Alaska began much later than the lower 48, and I appreciate the crowd because I'm assuming no one's laughing when I say lower 48, but people laugh here. But at any rate, the process in Alaska, it followed a very similar narrative. So it began with Russian occupation and Native enslavement in the 1700s. There was the sale to the US government through the Treaty of Cessation in 1867, whereby Alaska was divided by churches and boarding schools were instituted following more unspeakable traumas. Statehood was in 1959. And then the Alaska Native Claims Settlement Act, or ANCSA, which is our treaty with the US government, was signed in 1971. And this is whereby a fraction of Alaska Native lands were divided and allocated among for-profit Native corporations. And unfortunately, colonization has not ended. There are still land claims, blood quantum requirements, and we experience incredible health disparities. And this is just naming a few settler colonial impacts that continue and are systemic. But I also want to say, pre-colonially, there were established methods of healing and understanding the world. Alaska Native healers performed surgeries, including brain surgeries, which have been documented by the Aleutian Pribilof Island Association. Alaska Native people had and still have their own classification systems and versions of everything, right? Meteorology, physics, astronomy, botany, pharmacology, psychology, and the list goes on. Our histories, traditions, ceremonies, values have all been part of oral tradition and housed within intellectual and spiritual and cultural libraries that we know as Alaska Native elders. So I'd like to tell you about our research project, exemplifying an Alaska Native approach to Alzheimer's disease and related dementia, which I'll call ADRD, and caregiving. But first I want to make a distinction of uppercase elder and lowercase elder. So not all older adults hold the status of elder within tribes, communities, and families. But when individuals are looked at as the uppercase elder, their lifestyle is held up as an example for others to follow. They represent the connection to family and ancestors. They are culture bearers, they are wisdom holders, and they are knowledge keepers. And so our research specifically was conducted among uppercase Alaska Native elders, meaning people who have been identified in the community in this way. So let's get into the research. In order to understand pre-colonial and present cultural practices that compose really optimal ADRD, or think of it like as dementia care for Alaska Native people, a grounded theory exploratory study is what we conducted. And I just want to note here that grounded theory, it's a method of systematically analyzing data through inductive reasoning, and it's for the purposes of seeking emergent ideas and themes. And if you've done rounded theory, you know that it is incredibly meticulous and time consuming, but it's highly valuable. And another point to note is that our research utilized a social constructivist theoretical framework for our inquiry. And what that means is that we both acknowledge and we also assert that nothing is discovered, but it's co-created by the researchers and the participants, and it's informed by our lived realities, right? Our social norms, our values, and then the multiple perspectives in which we all reside. So we were intentional about using an anti-colonial and a decolonizing approach. The research questions that guided the work were, how do Alaska Native elders perceive Alzheimer's disease and related dementia? And what cultural views and wisdom inform these perceptions, inform treatment, and inform caregiving? And we use the conversational method. So that's a method put forth in the literature by Crouch in 2010. And this is where we gather knowledge through story. Because if you have been lucky enough to sit with an Alaska Native elder, you know that they often teach through story as opposed to being directive. So we had a purposive sample of 12 Alaska Native interviews that we interviewed through a semi-structured process. And we assessed the etiology, course, treatment, the caregiving, and then these culturally derived meanings of memory function, memory loss, memory decline, and then ultimately disease. And the elders we identified through a snowball sampling method, meaning that we had reached out to key contacts that we had to identify elders. Our participants, we asked them as well, like, who else should we talk to? Who's an elder in your community? And probably many of you today can, off the top of your head, think of one or two elders that are individuals that are culture bearers within your community. And so in terms of the demographics, the mean age was 73. We had 8 female and 4 male participants. The tribal background included 1% stated that they were Aleut, 7 were Athabascan, 2 were Inupiaq, 1 was Tsimshian, and 1 was Yupik. And we had a spread of educational level people. 1 reported a graduate degree, 1 an associate, 5 were some college, 2 GED, 2 high school diploma, and then 1 individual 8th grade. And so the qualitative analyses revealed 8 overarching and interconnected themes. And I'll just note, so it was a qualitative exploratory mixed methods design that we utilized. So interviews were audio recorded, transcribed, and then we analyzed the data using NVivo 12, because this was some years ago, which, if you know NVivo, it's a qualitative data analysis program. We also utilized the orthogonal cultural identification scale for Alaska Native people. And so the participants filled that out, and it indicated a high level of biculturalism. And what we know in the literature, we know this as walking in 2 worlds, essentially. And it's correlated with optimal success in navigating cultures while maintaining one's own culture. So here are the 8 overarching themes we observed. And I'd like to go through each with you and offer an example. So right here, there's traditional knowledge and values, Alaska Native spirituality, memory functioning, connection, communication, and compassion, stories, generative sharing and healing, historical change, caregiving, and then assisted living. So we'll start with traditional knowledge, systems, and values. So this theme was composed of sub-themes of walking in 2 worlds. So that balance between, one's own culture and maybe the dominant system, traditional healing, successful aging, holistic wellness. It was also composed of humor, traditional foods, addressing issues and barriers in Western care, and then aspects of disconnection from one's culture. And one person highlighted the strength of their traditional knowledge and practices by saying that, quote, "We didn't need hospitals before." And they're talking about before colonization. Another participant shared with us, there is a story that also says that people with dementia, they live such a hard life and they didn't do their talking and counseling or forgiveness. And that when they're going to the spirit world, it's their way of preparing themselves to transition back into that spirit world. So they may not be in their body physically, but they're in their spirit body. They're preparing themselves to go back into that world. In a sense, it was like a sacred thing for people to care for them. So this person is talking about how disease is more than just the body. There is a sacredness to being with and caring for our loved ones. And it was also pointed out that elders and youth are very close and important in the Alaska Native community because both are closest to the spirit world. And what happens before death is in preparation for going back into that spirit world. So the next theme is Alaska Native spirituality. And what's important about this theme is that we didn't initially ask about spirituality, but the last question we had on our interview was, what did we not ask you about that we should ask you about? What question, should we include? And it was about maybe 3 interviews in, I think. And the elder said, what is Alaska Native spirituality? Very, very, very powerfully, and said, this is what you need to be asking about. This is what frames our world. And so we were so grateful for that. And we then included it moving forward. We went back and asked it of the other participants, and we found it to be the theme that really contextualized all of the other themes. And so the sub-themes it was composed of were faith, relationships, reciprocity, nature, and returning to the second childhood, which I'll talk more about. So here's what one participant said. Native spirituality or Indigenous spirituality is the acceptance of your place in terms of the Creator's creation. Our spirituality is directly dependent on the fact that we recognize where we are, who we are in the Creator's world. And this speaks to the Alaska Native worldview and how spirituality is a framework for constructing and understanding one's world. Then we have memory function. So this was composed of sub-themes of negative and positive aspects of memory, gender differences, genetics and biology, this notion of the gift of the present, or that ADRD can really make you be in the present moment. Well, at times you're not, but at times it can just put you fully there. Then also a sub-theme of this explanatory model of disease, medication, and exercise. And what one participant shared that was particularly poignant, they said, we have tribal memory, which is related to storytelling cycles. Embedded in the storytelling cycles, there's the sacred stories. There are the creation stories, there are the teaching stories, and there's the birthing or family stories. Those were all relegated to specific members of the tribe. So this highlights how traditional ways reinforce and sustain memory. We were told that people who fulfill their tribal roles are healthier, and then other components of being. So the emotional, the spiritual, the mental, the physical, all play a part in healthy aging. Then we have connection, communication, and compassion. And this theme was composed of the sub-themes of language, love, acceptance, community, and then health literacy. So what the participants said is that a lot of people wanted to have more conversations with providers and with clinics, but they felt that they were largely in the dark. And here's what one of our participants said. And they're talking specifically about the person with ADRD. Like if, let's say we had a person like that in my village, this person will be at events. If there's a potluck, they'll go to it. If there's native dancing, they'll go. They'll be a part of that community, not separated. Again, people are whole human beings and more than the body and brain. Separation was viewed as a trauma that could cause memory issues and a forgetting of oneself, which was viewed as the ultimate disservice of colonization. Again, having someone forget who they are. And another elder talked to me about language and the energetic levels in terms of communication. So this person was Athabascan, and they said that pre-colonial Athabascan language had 3 energetic levels. The lowest level, the lowest vibration to this language, right? It was used for instruction, primarily with children, and it was inherently negative. It was like, no, don't do that, go here. Then the next level, which was a higher vibration, a higher energetic level of language, is primarily what everyone used. Like adults use it, was where people were able to articulate thoughts and feelings more fluidly, and it was positivistic. And then they said to me the highest level of this Athabascan language, it was incredibly high energy vibration where people could speak directly with the creator. They said that it was a language that was used by healers and chiefs and in ceremony and to invoke ceremony and changes. And then they said to me, so that lowest level, that lowest energy of language that's inherently negative and that we use only for instruction is where the English language resides. And they said, so it's incredibly hard in this dominant context in English to really say anything positive. And he said, that's why when you speak English, you find yourself struggling to reframe things positively and say them in a way that really conveys your heart, because the language itself, you're working in such a low energetic level. And then he went on to talk about how that impacts the healthcare setting, caregiving, Indigenous language, interaction with the English language, and those types of things. So I just wanted to point that out because I feel that that was an incredibly important and an Alaska Native perspective that needs to be highlighted. So stories, generative sharing, and healing. This was composed of sub-themes of breakthroughs, altruism, storytelling, intergenerational relations, and then culture. And there was one participant who she told us that she looked after her mother, and she watched her one day have this breakthrough where she came back to her mind, right? She came from the spirit world back to the physical world. And her mother began to tell these important family stories. She was passing them down and giving this gift before she died. And then another participant shared with us how her mother was able to, who also had ADRD, was able to see ancestors and past loved ones. And she said how this gave the participant herself, but her family and her whole community, this incredible, invaluable sense of comfort. And it helped her and it helped them to grieve together. So here's what one participant stated. On the trap line, they teach us when you're a young boy that you're going to have to take your father's trap line. That was your grandfather's trap line and his grandfather's trap line. In order for you to look for the next generation, you have to apply the same principles. You can't overharvest. You have to just take what it offers and allow it to grow back. So this participant was getting at the importance of passing down culture as forms of healing, responsibility, and being well. And they are also showing how there are consequences to our actions that can't be undone. So to apply this to caregiving, we have to be careful, mindful, strategic, and understand that everything done has consequences, even the historical changes, those that are wanted and those that are unwanted. And they answered my question in a story, which is kind of beautiful and apropos. Then we have historical change. So this was composed of oppression, mental health issues, stigma, substance misuse, unhealthy diet, social justice issues, and broadly trauma. And what one participant told us, they said, when you look at the assimilation and the acculturation of Native people, the unseen part of it, the belief system, is what's powerful. What we went through is a lot of brainwashing. It's up to us to let go of those and start saying, hey, we want to correct that, because what's in your mind affects your body. It's such a deep connection. So this highlights how the body is impacted by the mind naturally. And some participants talked about the traumas that weigh, actually most, talked about the traumas that weigh a person down and lead to physical pain, physical problems, ailments in the mind, body, spirit. And they talked about how memory loss is a way to heal traumas, which at first sounds like, wait, what? I think a lot of time, sharing this, people are a little confused about that. But they say that it's a way for people to heal traumas. And I think that will make sense as we talk about the theory around this. But this also includes historical traumas and intergenerational traumas, because it allows the person to be in the spirit world and visit parts of their life that were painful and work through those past traumas. So the next theme is caregiving, and this was composed of family caretaking, community caretaking, environmental access to care, the positive and negative aspects of caregiving, and then planning, advocacy, isolation, self-care, and then death and loss. And what one participant said to us was, I think the whole family, we took turns taking care of our grandmother. In the springtime, I remember her going out to the spring camp with us, and she stayed there all spring with us. And then when we moved back to the village, she went to one of the other aunts to stay for the summer. She enjoyed being with different family. And us grandkids got to know her that way, instead of just putting her in one spot. So this quote exemplifies how caregiving was communal, shared, and it wasn't constrained by the Western predicament. And here's what people told us, working 40-hour weeks away from home and having no other family members or friends around. Lastly, we have the theme of assisted living. So this was composed of sub-themes of aggression, autonomy, issues of aging in place, person-centered care, vulnerability, financial limitations, and then the differences between the urban and rural environment. So one participant shared, you're listening to them, respecting as much as they can convey what they want or what they need. I think a lot of times we want to push our own values on them, but as caregivers or family, we need to recognize they've lived their life. They have the right to say where they're going to go and what they're going to do. So one participant talked about how she had to put her mother in a home in Anchorage, far away from their village, because it was what was available. And she shared how it was so painful because she saw her mother deteriorate more rapidly. And she also noted that in this particular place, there wasn't access to traditional language, ceremony, or foods. Then another participant talked about how they had to choose a home that was not what they wanted, but because of financial constraints, they had to make that choice. So essentially, this was a home that was of lower quality in their view. And I mean, just imagine that yourself. Think about the intense feelings that would come up, maybe guilt, worry, and the anxieties around them being somewhere that you feel like is not good enough. So the elders also talked about how historical change impacted the ways in which families could take care of their loved ones. And that goes back really to the previous theme of historical change and how the structures of community and family are very different for many Alaska Native people due to Western systems and values. So what we learned was that holistic indigenous theoretical concepts support a culturally derived Alaska Native caregiving model. And this was reinforced by other biopsychosocial theories in the literature, namely the ecological theoretical framework, which focuses on interactions of the self within systems and then this integral role of place, for example, aging in place. There are the psychosocial theory, which puts forth that early development is really impacted and governed by virtues or values acquired through life stages that really lay the foundation for future success. There are Indigenous frameworks. So this is also an Alaska Native Indigenous framework, but across the world, that put forth that successful aging is a harmony of the physical, emotional, mental, and spiritual worlds. And then we see that lifespan developmental theories provide foundational tenets to complement an explanatory and culturally based theoretical framework for understanding aging and caregiving as a process that goes from birth to the grave and beyond. So through this process of learning from Alaska Native elders for the past 6 to 7 years, I've come to understand that Indigenous healing is more about, really in this frame, dismantling colonial oppressive concepts than it's about adding new ones. And it's both ancient and accessible to all. And what Alaska Native elders teach is that who you are and the knowledge of your people across generations lives within you. The Indigenous worldview challenges the disease model. Is there disease? Yeah, yes. Is there more than just disease? Yes. So Native people live within two, I would argue, perhaps multiple worlds, and there is the reality of the old world, and then there's the reality of the present, maybe colonial world. And we all live within these multiple realities at all times. Perhaps this is what brings you to this talk. On some level, you can feel that we are all connected, but Indigenous teachings know this inherently and accept it as truth. So we utilize the Yupik family model, which you can see here in this slide, with permission from Elizabeth Sunnyboy and the elders and ancestors of the Yukon-Kuskokwim region, and working with elders to understand ADRD, we developed an Alaska Native life cycle theory. And it's composed of 4 quadrants to understand the life cycle in terms of chronology, but it is not time bound. So people can heal across quadrants and their life of, regardless of when this occurs. So here's quadrant 1. This is the entrance into the physical world from the spiritual world. So the baby is born, right? There's teachings on traditional knowledge and values, connection, communication, and compassion, and teachings on love are really foundational to personhood. Examples of what occurs in this domain include being given a native name, learning about your family, receiving unconditional love from family, or maybe an adopted grandparent. Not only is it critical in the developmental time, but it's also a very spiritual time of grounding in the physical body in the right way. In the second quadrant, this is the emotional world. So this is where youth receive teachings on hunting, on different roles in the tribe and community. It's what is expected of you. Examples include learning about plants as medicine, going to live water, because what the elders taught us is wherever you go in the world, the water will connect you. And they teach that even if we have strong emotions, but we don't know what to do with it, the water does, because it has a healing energy. This is where people develop the skills necessary to care for themselves, others, and the land. And within this quadrant, it really sets the stage for the installation of cultural healing practices and worldviews that are holistic. In quadrant 3, this is the mental world. So this is where adults receive teachings on historical trauma and also teachings on how to live well. Examples would be the steam bath, so taking saunas to make a spiritual space for contemplation. Something like soul retrieval, so a healer leads a person through a ceremonial process of retrieving parts of themselves that have been taken or fragmented off during the shock of trauma that's occurred in their lifetime or historically intergenerationally. This quadrant is an opportunity to not only come into awareness of trauma, but to actively heal them through cultural practices. Essentially, a healthy mind and body are crucial for a fulfilling life, is what we learned. And they're crucial for opportunities for healing and for promoting the healing of others in family, in community. And then lastly, we have the fourth quadrant. So this is the spiritual world. Adults and older adults receive teachings on partnership and children, teachings on leaving home, the physical home and the physical body. And then Alaska Native spirituality informs assisted living choices and healthcare access and quality within this domain. So many Alaska Native elders in our project viewed ADRD in terms of this concept that I mentioned earlier of returning to the second childhood. So people become childlike and go through phases and preparation for returning to the spirit world, is what this means. For example, end stage ADRD might include kicking and fighting, which is symptoms of essentially the brain dying in the Western sense of ADRD, or the medical sense as well. But from an elder perspective, this is a time where the person is working out a past trauma that likely occurred in the physical quadrant, for example. And they are doing this to not bring it into the spirit world, but to bring in their healing back into the spirit world or the universe. The family is taught to give them space, make the environment safe, and allow them to fight the battles they need. It also reframes the process into a more positivistic view, and it gives it meaning. And the Alaska Native elders taught us that ADRD can give the gift of the present and also allow the person to live between this reality and the spirit one. So this concept also speaks to the crucial importance of elders and children being teachers and being close, because they're both closest to the spirit world. So one is coming in and one is preparing to return outward. So the Alaska Native life cycle theory is ecologically and contextually relevant. It's strength-based and exemplifies community resilience with respect to views on memory, ADRD, aging, and then social determinants of health. So health at any given time is influenced by past experiences as well as present circumstances. And there is this intra-dependence between the two for Alaska Native people. So development considers, well, the origin, so ontogenetic development considers historical oppression, colonialism, discrimination, and racism, and how these can disrupt development and socialization at critical periods that lead to health inequities and social status differences, which persist across the lifespan. And so going back to putting this theory together and putting the things together that we learned from the elders into recommendations, into an application, it really comes to health communication, and designing Alaska Native health campaigns is really the next step and synthesis of this work. So as I mentioned, the theory, our theory, is a driven approach that it highlights ecological theoretical frameworks that are focused on this interaction of self within systems and the integral role of place, right? But taking this further, there's also the interaction of community within the broader social structures of the dominant Western culture, which we have to contend with. So designing health campaigns to focus on cultural stories, Indigenous imagery, Indigenous language, words, places, and then be followed up with a continued evaluation of, the cultural importance and the applicability is crucial. They should also include health literacy interventions that support a provider-patient relationship where it can be built and knowledge can be shared. There should be educational media campaigns for awareness raising and prevention. What came out of this as well was potentially a website repository of resources, and then community art events and cultural events to promote dialogue, to share culture, to create that collaboration, and then to ultimately promote knowledge and health literacy that, again, is shared And then from a broader provider perspective, healthcare would include mechanisms for reimbursement for traditional healers. There'd be a shift in the in the emphasis on evidence-based practices to practice-based evidence. So understanding what has worked for time immemorial within Indigenous communities. And an extension of that is also like culturally adapted and culturally tailored practices, where Indigenous knowledge is viewed as valuable science that's integrated. And then lastly, to integrate mechanisms and supports within health systems that address the wide variety of stressors that Alaska Native people experience. So thinking about social determinants of health and the interaction of racism or discrimination and historical traumas. But also thinking about culture and strengths and resilience, and the fact that, like the one elder in our study pointed out, quote, "We didn't need hospitals before. People were living full lives and thriving and healthy and happy." So understanding what existed then, what worked, what did people put in their bodies, what came out of their bodies, traditional foods and medicine, but not just ingested in that sense, but spiritually, mentally, and emotionally is really integral. One of the main takeaways from our work is that healthcare systems providing services to the Alaska Native population or Native populations could benefit from elder-centered conceptualizations and approaches to care and caregiving. And really, all healthcare systems, right, could benefit from a tailored approach to treatment as opposed to a one-size-fits-all approach, which we predominantly have. And that's what our participants reported to us, that one-size-fits-all approach to them felt culturally incongruent, stigmatizing, and even at times inhumane. And our observations reflect this imperativeness of indigenizing care by making central cultural practices and social self approaches. And so what I mean by that is person-centered, but the person is central to and derives their personhood from their community and their culture. And care revolves around deep cultural beliefs and prescriptions for living life in a good way. Caregiving honors land-based connections, such as aging in place. I know I've said that a lot, but it's really critical, especially, that's not only why we acknowledge land, but as Native people, we understand that, before we didn't own land, the land owned us. We belong to it. There's a symbiotic relationship. And then there's this interconnected aspects of people, tribe, nature, and animal. And caregiving is community focused, and it happens in the context of community and family. It's never done alone or in isolation from the culture or the community. And then lastly, care entails balance and harmony of the physical, emotional, mental, and spiritual worlds. If you have disease in the brain, for example, you're not any less of a mental being, any less of an emotional being, any less of a spiritual being, or any less of a human being. So Dogadin, thank you. I also want to offer a special acknowledgement and thank you to Yupik Alaska Native elder Liz Sunnyboy, who's been a cultural advisor on this research, a mentor, and a very patient and long-suffering friend from the beginning even until now.
Thank you so much. That was just beautiful. I have a whole 3 pages of notes. I'll have to watch this again. I want to open it up to anybody that has questions, and I'll also be monitoring the UAS live stream. If you have, you can put your questions in the chat there. So does anybody have any questions for Dr. Crouch?
Sarah, I'm going to start out real quick. I also just want to say thank you so much. And so much of your process rang true with me. That's exactly how I did all my research. And I just wanted to say that I appreciated what you said about assisted living and people who had left so much behind when they moved into urban assisted living situations. And we were really fortunate. I think about a month ago, we had someone from ANTHC and NANA come down and talk to us about bringing traditional foods into assisted living facilities. And hopefully we're going to see some more of that happening here in Southeast Alaska. We introduced that from the northern parts of Alaska down here to Southeast. So I can really appreciate how important that is for people who do have to move into assisted living to have some of their traditional foods available. So that really resonated with me when you talked about that. Thank you so much for everything. This was an amazing talk. Like Sarah said, I have pages and pages of notes as well.
Thank you. That's an important point. And also to highlight that there are so many tribal organizations doing the work and doing a lot of this, but we need more help, right? We need people to be on board and to make these connections and to have something sustainable where people don't fall through the cracks. And I would add too, I know that people are asking me questions, but I put a question up there for folks as well of, what have your elders taught you about aging, memory, or caregiving, to really think about what I shared, which isn't coming from me, it's coming from the data, it's coming from what the elders shared. And maybe, how have you internalized that and what does it mean to you? Because I would add that doing this research, I was changed as a human being to be with elders and to sit with them for hours and to talk with them and to hear stories. I was changed and I was, bettered as a human being from it.
Awesome. Okay. Are you fielding personal questions today, Dr. Crouch?
Yeah.
I just wondered if you happen to know Leonard Williams from Angoon who lives in Anchorage.
I don't think so. No, I don't think so.
Well, thank you. But that's very interesting. And the idea of the spirituality missing in the treatment process is fascinating.
Mm-hmm.
Thank you.
Thank you.
I had a question on the comment you made about individuals who fulfill tribal roles are healthier.
Mm-hmm.
What are some of those roles? If you could speak a little bit to that, please.
Sure. So that a lot of the talk around that in terms of like that individual that shared that with us was speaking to the roles of, for example, learning to hunt and going out and doing that for the family, and how all of the ways in which that can make someone healthy across their being. So the healthy piece of being in nature and getting fresh air, moving your body, the spiritual and emotional piece of the cultural practices, learning, being with your elders and your family and learning how to do that, and the pride that comes from enacting that role, carrying that role out, and to be able to share that. And then again, it's something that keeps on giving and giving and giving. So they were talking about that, and they had also shared at one point as well that they themselves had an issue in their life with a particular substance, and what helped them to recover was going back to their role. And it was particularly going back to nature and hunting and doing their role of what they have learned. What other folks talked about is that, there are some people within the family or the tribe that hold the stories. And so giving the stories to them, because how they explained it is if someone's given a story, it becomes their story now. and that's sacred. It's in the Western sense, it's like, oh, there's a research article, and then I give you this research article and you read it and you do the research and then you cite it, but it's so much more profound than that, because this is like generations of holding this story within them and then bringing it down and passing it down. That was another role. Or they talked about a lot of roles that were very culturally specific that people fulfill, but also, these make sense cross culturally. A role of being a mother, and what does that mean? A role of being an auntie or a father or a friend, and what does that mean? But to really be, and it goes back to the notion of being present, because there's a gift of being in the present for ourselves, is what they were saying, but giving the present, giving your presence, to be actively engaged and knowing exactly what you're doing and why you're doing it, has all these profound effects on one's health.
I love those ideas of both being present, the present as a gift, and your presence as a gift for others. And that's amazing. And that's just so powerful. I also really like the idea of who you are lives within you, and knowing that that person, even as they've gone through changes, maybe some mental changes or something, that person, their personhood lives within them and is still inside. And it was new to me to think about their part of the change is becoming closer to the spirit world. And you hear stories of some older people and their memories of far long ago times, and possibly some of that is just they have more of a connection with things that they heard long ago that they're able to touch into that they weren't able to before. So just lots of insight in your talks. Oh my gosh, so much richness there.
Thank you. Yeah, I encourage anyone to, I tell my friends as well, and I've done this in my own family, but go to the elders and I bring a camera and I record and I say, just tell me stories. Tell me about your life. Like, what do you want us to know? And it's, but it's a library. I go and do one interview and I'm sitting in a library, right? But I'm not pulling the books myself. The books are coming out to me and opening up, and it's a really beautiful experience. And that was what the elders taught, that our knowledge as Indigenous people, or as our whatever culture we're from, that's written in our DNA in a way, and it lives within us. And so how I heard one person explain it, and this was actually at the Alaska Native Studies Conference probably 10 years ago, so it wasn't in this research, but they had said something really beautiful, and they had said that maybe the language was stolen, but you'll find new words, because the feelings and the thoughts and the language lives within you, and you'll find new words. Mm-hmm. Or you'll find
yeah. I was going to say, and what a gift I've found, what a gift you're giving that person when you ask them about their stories and ask them to share with you, to open up that opportunity for them to share. And especially older people aren't going to have that much more opportunity. So, if you can give them a little bit more opportunity to share what they know and what they've lived and their experiences, and leave that behind. I mean, what a gift you're giving them.
Yeah, there was one elder that I talked with who told a story and then just started to cry and cry, and then said, thank you for asking me that, because then I was able to talk about this. And I hadn't thought about it in years. And it was really powerful to see that and to experience that and to hear the story. Yeah.
Well, for those of us watching, we don't have any questions on the chat. I will say that our next installment of this is December 15th with Dr. Brittany Howell, and she will be discussing evidence-based practices to help delay memory decline, and that will be at the Egan room 112. So Dr. Crouch, this was just beautiful. I have so much food for thought. My soul is just, and actually, where can we go to learn more? Do you have any references or things that you would say, read this, or things that come to mind that say, check this out if we are interested in learning more about this? For those still watching.
Yes, there are. Well, there are two. I don't know how we can get, I mean, I could send them to you and you could share them with folks, but
Okay.
there are 2 book chapters that we've written in relation to this as
Okay.
well. And there is an article that we wrote too, specific to sub-analyses on social determinants of health related to this. And then we have another journal article in, I'm on them all, but so if people were to access that just through my name, they would come up. But there's one in Alternative. It's an Indigenous journal, and that's on elder-centered research methodology. And so that one's putting together this research and then some research with colleagues that came out of it, how those all speak to having elders central to what we do.
Great. Yeah. For those still here, and I'll just put a plug in there. If you would be willing to share that, that would be wonderful. And then you can email me at snico@alaska.edu for those still watching. And my email is on the flyer too. So that would be wonderful.
Thank you for that. That will be, I'll look forward to seeing those.
Yeah.
Yeah. Thanks so much, Maria, for making this happen.
Yes.
And sharing with us. Yeah.
Yeah. All right, everybody. Well, be well. Take care.
Hopefully see you for the next one. Yeah. Thanks.
Bye-bye.